Right, welcome to the team brief here at Charnwood Mill. Thank you for coming. This is an account of where I think we are in the world, what's happening in the NHS, what's happening in the broader picture, and how we need to respond and what's happening in LPT. I'll talk for 5 or so minutes. So, what's happening in the world? You may have noticed that there's going to be there's been various announcements. There's going to be a 10-year plan for the NHS. That plan is going to be published probably in the next week or 2 or 3, certainly by the first week in December. Lots of people that I know have had lots of input into that 10-year plan, but it is going to be our blueprint for the next 10 years, and it's certainly going to be the blueprint for the next 5 years. There's already been the financial bit announced that we're going to get 3.4%, I think, in real terms each year for the next 5 years. And of course, people expect that there'll be a return on that if they're going to invest more money. And most public services are not getting more money. So where we're getting more money, we're going to have to do something with it. Now, in reality, 3.4% is what we need just to stand still, because of demand and growth and all of those things. So, but it's still going to be an expectation. What's it going to say? Well, it is going to focus on mental health and community services, the sorts of things that services we provide, because that is the future. We can't just continue to buy more wards and more beds. It is about caring for people closer to home, focusing on prevention. So what do we expect? We expect in the mental health arena that there'll be 0 to 25 services, that there'll be much more focus on prevention, on crisis care, on recovery, keeping people well in the community, less focus on beds, less focus on out-of-area beds, less focus on specialist-type beds, and bringing people back into to near where they live. But we also expect quite a bit on community. I think there's less intelligence on what it's going to say. But we know we've got to turn off the tap of people attending the acute hospitals. It's continuing to go up 3, 4, 5% a year this year, just in LLR. So more emergency admissions. And we've got to find ways and invest in the community services that can manage long-term conditions better in the community. Keep people out of hospital. When they do get into hospital, get them out quicker. But principally preventing them going into hospital in the first place. And that's a big challenge, because so far we have not, in Leicester, Leicestershire and Rutland, evidence that we can do that. It's gone up every year since I've been here. There are 1 or 2 places in the country that seem to have evidence that they can turn that tap off. And it's about integration. It's about the way in which we work with our partners, the way in which we work with social care, the way in which we work with primary care. Seems to be the key to turning that tap off of acute demand. So that's how we're going to have to work. So, and that's pretty much what you've heard of, a thing called the STP, our Sustainability and Transformation Partnership, which is all the organisations working together. We are going to define working even more closely together. We'll still be in separate organisations, but we'll need to work on how we develop integrated locality teams around places and neighbourhoods in order that we can deliver those benefits that we need to turn off that tap, to manage long-term conditions better in the community. More work to do on that. I'm going to be leading that piece of work for LLR over the next year or so, developing integrated care systems. So hopefully I can guide and steer that in the direction we need to go. What do we need to do in LPT? Well, there are lots of things we need to do. In order to respond to this, we need to work out how we're going to work in a more integrated fashion, but we need the right culture. We need to generate and develop the right culture, the right just culture, how we respond to learning, how we respond to incidents. We need to commit to a culture of learning and improvement. So when I ask, this needs improving, this needs developing, do we have the skills, do we have the expertise to deliver that improvement? We need local leaders, we need leadership at a local level to help and do those improvements. And we need to spend less time in meetings. I'm going to write a series of principles around the way we do governance, because we spend way too much of our time in meetings, writing papers for meetings. There's meetings going on at the moment, board subcommittees, 200, 300, 400 pages of papers. Someone's written those. And some people, there's far too much in the way of spending time at meetings which aren't about improving what we do. I want people to meet to work out how to improve things, because everybody's got an opinion. I don't really want people meeting just to talk about numbers. So lots of things to do. On a more practical level, CQC are visiting us this week. I'm not quite sure how many inspectors are here. 35 inspectors. So they're visiting 5 areas of the trust. Mental health acute services, mental health rehabilitation, learning disability inpatient services, our CAMHS community services, and mental health for older people community services. So I'm really hopeful that we'll see an improvement in those areas. They should have been visiting community health services, community hospitals, but they, for a variety of reasons, didn't have the capacity. But I anticipate that they will be coming sometime in the next 6 months to community hospitals. It's also flu season. There's been 1 or 2 outbreaks of flu around the country. We don't know whether it's going to be a big year for flu, but please, if you haven't already done so, get your flu jabs. It does protect you, it protects your patients, and it protects your family. So really, really important we do that. And we've still got a couple of weeks to go on the staff survey. So if you haven't filled your staff survey, and we do look at them, we do read them, we look at the amalgamated findings from those to think about what we can do more of and what we can do less of as well. We've also, at the moment, just working with our partners on the community services review. I know many of you might be impacted by that. We can talk about that later. Our commissioners wanted to understand our community services and do a review of them to make sure that they are working at their most effective and efficient, working collectively together. So we're still waiting to see the high-level outputs from that, but we should be seeing those again within the next week or 2. And we've got someone coming to the board who's going to present those in November. Finally, I just wanted to end on a few risks. Well, 2 things. Risks. The biggest risk the Trust faces is our workforce. We've got over 200 registered nurse vacancies in the organisation today. Across LLR, across Leicester, Leicestershire and Rutland, there are over 800 registered nurse vacancies. Our local universities produce about 200 graduates a year. And then with people leaving and retiring and doing all the things that people do, that sum does not add up. So we've got to be inventive in the way we use our workforce. We've got to find new roles, and until we can get that, it's going to be really hard to deliver the improvements that we want to deliver. And then finally, just a few positives. It was AHP Week a couple of weeks ago, which was great to see everybody celebrating that and the diverse range of skills that we have in the organisation. We also did a health and wellbeing event. I don't know if anybody managed to get there. It was in Leicester at NSPCC. About 250 people turned up to that, celebrating what we can do to improve our health and wellbeing. As you know, I'm really keen on the old physical fitness bit, and ran the Leicester Half Marathon for the Diana nurses, and we raised about £7,500. Leicester Half Marathon. Did I say marathon? Leicester Half Marathon. Gave up at halfway. That's fine. Really important. And we also had our Leading Together group last week, which is about senior leaders in the organisation coming together to develop our culture, to develop our skills about improvement, and develop our own leadership skills. I'm hopeful that we continue to improve. I'm really hopeful that we're going to see an improvement with the CQC on this occasion, and we look forward to getting their report. And I'm very happy to take any questions from you.